Within the spectrum of health, you have three different categories of health care. And the difference between these types of healthcare is that the emergency care is where you go if you have a severe car accident, if you break a bone, or if your appendix decides to burst. This is where you want to be. So their job is literally just to keep you alive. The allopathic healthcare model, they group together your signs and your symptoms, and then they put you into a category and give that a man-made name, which is called a diagnosis. And for that diagnosis, the allopathic healthcare model's treatment of choice will often be man-made synthetic drugs and medication. If you have something like high blood pressure, or you have high cholesterol, or you have type 2 diabetes, how long do you have to take that medication for? You basically have to take it for life. So the problem with the allopathic healthcare model is that they don't do anything to really fix the underlying causes. Their role on the allopathic healthcare model is to look at your signs and symptoms, try and give you drugs and medications to basically manage it and mask those signs and symptoms so you don't feel it. The salutogenic healthcare model is where I am as a chiropractor. Now, of course, you don't need to be in this area when you start seeing a chiropractor. And in fact, most of my patients, initially when they start seeing me, they start down this end of the spectrum, or they've already tried the NHS route and they're not getting the answers and the improvements that they need to see. I focus on a holistic approach, which includes your physical, mental, and nutritional and environmental well-being. If we can identify the weaknesses in those areas of your health, and we can then start to change them, you will then find your overall health and well-being improving. And as your overall health and well-being improves, guess what happens to those signs and symptoms? They start to dissipate, they start to disappear. You start to feel a lot better in yourself, you start to feel more energy. This is the reason why people will continue to see chiropractors even once their aches and pains and headaches and migraines have stopped, because they feel that when they're in this area, they feel a lot better in themselves and their overall quality of life improves. And once we're here, everything needs a little bit of maintenance. You never get to the point where you're brushing your teeth one day and you go, oh, brilliant, my teeth are clean. I never have to brush my teeth ever again. Or we never get to the point where we finish our gardening and then we go, brilliant, my garden's done, now I never have to do my gardening again. Or you go to the gym for a couple of months, you lose a load of weight or you gain a load of strength and you go, brilliant, I never have to go to the gym again. Life just isn't like that, and our body's no different. Everything needs a bit of maintenance to look after it, to keep it healthy for the longer term.